Shares of United Health moving in the pre-market once again today. That comes after serious allegations last Friday that the Department of Justice is investigating the company's billing practices in relation to Medicare Advantage. The stock, if you're looking over the week, was down by 10.5%. According to the Wall Street Journal, at issue is a practice by private insurers like United Health that's called upcoding. That's where the insurer overbills the government and therefore the taxpayer by adding diagnoses to the patient that are designed to trigger additional payments to the insurance company. For insights on this complex issue and possible ramifications for the wider industry, we want to bring in Dr. Toby Cosgrove. He's former CEO and current executive advisor to the Cleveland Clinic. And Toby, it's great to see you here today.
Nice to be here, Mike. Thank you.
This is pretty complicated. You start wondering what it's all about. This was not just UNH that sold off last week, but also companies like Humana and CVS, other insurers. A lot of questions about Medicare Advantage program. What's happening here? What can you tell us?
Well, I think it's really interesting what we've got here. A lot of people, I don't think, understand the origins of it and the differences between just Medicare and Medicare Advantage.
I don't.
It turns out that back in 1965, Kennedy was the guy who brought Medicare around. And at that point, the people that were over 65 didn't have any insurance at all to cover them. Now, 2% of the people in the United States don't have any insurance to cover them. Things went along well, but they were realizing that it was costing a lot of money. And so 30 years later, the Clintons brought around what they called Medicare Advantage. The idea was to improve the quality and to bring the private sector in to make it more efficient than the government could do. Now, several interesting things happened out of that. First of all, there was some efficiencies brought. The number of hospital admissions for Medicare Advantage dropped 50% compared with just straight Medicare. There was a 20% reduction in the number of people going to the emergency room. There was much more wellness brought in, but and people flocked to it. In the last decade, the number of people who have Medicare Advantage has gone up, doubled in that amount of time. And now 54% of people over 65 have Medicare Advantage. Now, the reason that they're interested in this is because the co-pays for Medicare Advantage were substantially less for the individual than they were for just straight Medicare. There's bigger co-pays there. But the disadvantage is that it's costing more. It's costing the government more. So what they did is they brought in the government to essentially administrate the Medicare and all the insurance companies.
We brought in the government to take care of...
The government brought in, I'm sorry.
Okay, the government originally brought in private industry to try and make it more efficient.
Exactly. And that's where
it became more efficient on some places, but then the cost ballooned there, too. So what happened?
Exactly. And so what you look at now is that costs about $100 billion more, or 30% more than it would if you were in straight Medicare to the government.
Why is that, and what is this practice of upcoding?
And part of that is what has been, people are upcoding, and the risk scores are going up, as you explained at the beginning here. And that is widely used throughout the industry. Some companies more than others. But there has to be a solution to this.
Is it fraud? Like these companies, insurance companies saying, okay, we're going to add these diagnoses on because we get paid more for that, even if you don't have the diagnosis. That sounds like straight out fraud.
Well, I'm not sure you call it straight out fraud, but I think everybody has done it, and it is something that does benefit the insurance companies. And
how is it not straight up fraud? I mean, I'm giving you a diagnosis that you don't have because I'm going to make more money from the government.
Well, maybe you don't have, but maybe you do have, and it's not treated. I mean, for example, you might have obesity.
Diabetes. And they argue that a sort of an early diagnosis of all these chronic conditions is exactly what you're trying to do to keep down costs long term. But then you throw in I don't even remember the common one. It was hormonal something or other that you don't even need to test for, and it's very obscure. but it jacks up the rates that they can charge.
It just sounds like a game of whack-a-mole where the insurance company, the
So,
government tries to say, okay, we're only going to pay for these things because we think this leads to efficiencies. The insurance companies figure out, okay, here's how we game the system again.
So I think this is an abuse, and the question is really how do you fix it? And it's interesting that MedCap, which is an independent government agency, came along and said, here is the approach that we'll do with this. And we will reduce the amount of upgrading, if you will, of Medicare patients. And we're going to do it in a two-pronged way such that people who are abusing this more will get more of a reduction. People who are using it less will not.
People meaning insurance companies. Because it's not the patients who are doing the abuse.
That's exactly.
So if you are an insurance company that does a lot of this, and maybe this is the department, we still don't know, we're just guessing that the Department of Justice investigation into this will aim to put a chill through the rest of the industry and keep insurance companies from doing this?
Yeah, but I mean, I think you have to have some sort of a way to do it, and I think MedCap has a very approachable, fair way to do it, so that people who are using it a lot are penalized, or companies that are using it a lot are penalized more and reduced more. So I think that there's been a lot of good that has come from Medicare Advantage, particularly for patients. But there's also been some abuses.
Yeah. Dr. Cosgrove, we're almost out of time, which is crazy. Come and explain the most complicated thing we can possibly think of and do it in 6 minutes. But is this something that's fairly common practice among hospitals, among doctors, among insurance companies? I mean, I can think of a few instances myself where, you can't get services, you can't get therapies for certain things unless you have a special diagnosis that maybe doctors give out freely because they understand that's the only way to get the system to pay for the services that are needed.
I frankly don't think that this is common amongst doctors and hospitals that do this. This is what we're looking at here and has brought this to attention is insurance companies.